Good evening, it's 8 o'clock. The top headlines tonight. The Supreme Court insists the centre must give oxygen for states. The centre appeals today against a Karnataka High Court order asking for more oxygen. The Supreme Court says you cannot leave Karnataka in the lurch. Also orders the centre, Delhi must get 700 metric tons of oxygen. We are not drivers to bother about tankers, sort it out. Amid Tamil Nadu's worsening crisis, the new Chief Minister is sworn in, M.K. Stalin. The first decision, the state will now pay for COVID treatment in private hospitals, also COVID relief for everyone. Beds and oxygen, however, remain a major challenge for Tamil Nadu patients. Karnataka extends its new tough lockdown. Meanwhile, we report from inside Bengaluru's COVID war room after MP Tejasvi's communal outburst, the aftermath. Meanwhile, moving to Kerala, where the focus is on saving lives in Kerala's oxygen war rooms, real-time tracking of oxygen. Maharashtra gets ready for a third wave. The focus, the health minister says, will be on children, and pediatric COVID wards are now being set up. As deaths rise, our special report, the life of a cremation ground worker. Just 19 years old, he works with no PPE suit and no vaccination. He says, I work from 5 a.m. till after midnight. Huge crowds at Friday prayers before Eid in Hyderabad. The state announces bans on any gathering, social, political, religious, only in the evening after these prayers. The Prime Minister, Jharkhand Chief Minister phone call. The Prime Minister inquires about the COVID crisis and the backlash as the Jharkhand Chief Minister tweets the Prime Minister talked of only his Mann Ki Baat. From Indians in the United Kingdom, help pours in. Oxygen being brought from London to New Delhi and other parts of India. NDTV special report from London's Heathrow Airport. Let's begin with the latest numbers. Once again, India has touched a record high with 4.14 lakh cases just in the last 24 hours. We've gone above 4 lakhs for the third time in a week. So our daily average is now almost 4 lakhs a day at 3.89. The highest number of deaths is back to Maharashtra at 853, in Uttar Pradesh 350, Delhi 335, Karnataka 328 and Chhattisgarh 212. Meanwhile, the principal scientific advisor today said that the third wave, which he had warned about just yesterday, need not happen if we take difficult steps.
If we take strong measures, the third wave may not happen in all the places or indeed anywhere at all. It depends much on how effectively the guidance is implemented at the local level, in the states, in districts and in the cities everywhere. Now this sounds difficult, it is difficult, but we can and must do this. When the virus runs out of opportunities, infections fall. The virus runs out of opportunities if the number of people it can potentially infect is lowered drastically. This happens because people who have been infected earlier are unlikely to be reinfected for a while. People who are vaccinated are protected, and people who wear masks are distant from each other, isolated from those who are infectious. They are also protected.
So the big question remains is, when will this current second wave actually start subsiding? Well, the government is putting an optimistic spin on it, saying cases are falling in some major states, including Maharashtra and Chhattisgarh, states which are hit first, and notably also plateauing in states like Delhi and even Uttar Pradesh. But the big question remains is, are we testing enough when we are saying that cases are actually plateauing or coming down?
उत्तर प्रदेश का भी वही है। अब एक समय पर उनके केसेस थे 34,813 और आज 30,000 है। तो इसका मतलब ये नहीं है कि यूनिफॉर्मली सब जगह सब कुछ हो रहा है, जैसा कि मैंने पहले भी वर्णन किया था। हो सकता है कुछ जिले ऐसे हों जहां पे केसेस बढ़ रहे हों। नंबर्स क्योंकि इतने लार्ज हैं तो और डिक्लाइन स्लो है, इसलिए अगर हम अपने जो कोविड अप्रोप्रिएट बिहेवियर या जो रिस्ट्रिक्शंस हैं, कंटेनमेंट की जो स्ट्रैटेजीज हैं, अगर उन पे एम्फसाइज नहीं करेंगे तो हो सकता है कि फिर से बढ़ने शुरू हो जाए, पर ये एक इंडिकेटिव चीज है।
And the big worry, of course, is that our case is so high that we're currently regularly accounting for over 40% of daily cases in the world. So let's just look at this chart of how this pandemic has panned out since it actually began. The first global peak in January when the US reported over 3 lakh cases in one day. But India's second surge, where we've seen over 4 lakh cases on 3 days this week, has taken this global peak currently past the high of the first week. So Dr. Fahim Yunus, a widely acknowledged COVID expert, has tweeted that with these numbers, and this of course not just in India but also in countries now like Thailand and Nepal, which is seeing fresh cases, that he doesn't see the pandemic ending in 2021. Well, our other lead headline today is the Supreme Court insisting the centre must give oxygen for states. First, the centre appealed in the court today against a Karnataka court order ordering over 1,000 metric tons of oxygen to Karnataka. The Supreme Court rejected this appeal, saying Karnataka High Court has taken a considered decision and we can't leave the people of Karnataka in the lurch. The Supreme Court also ordered that Delhi must get 700 metric tons of oxygen.
First Delhi, now Karnataka. The Supreme Court has intervened and ordered the centre to allocate more oxygen to both. Both are among the worst hit by COVID currently. In Karnataka, the High Court had directed the centre to increase the oxygen allocation to 1200 metric tons per day. Instead of obeying the order, the centre immediately challenged it, arguing in the Supreme Court today that if every High Court starts passing orders, it will lead to chaos across the country and it is unworkable. Let High Courts distribute oxygen as we have limited quantity. But dismissing the centre's arguments, the court said, we cannot leave the people of Karnataka in the lurch. It is a well-calibrated exercise by the High Court. Karnataka's minimum requirement according to the state is 1100 metric tons. Dealing with the oxygen crisis in Delhi, the top court warned the centre, saying, do not force us to take coercive action. You have to allocate 700 metric tons per day till further orders. Centre put lot of caveats on tankers. We will not go into that. We are not drivers. With Arunachalam Vaidyanathan in New Delhi, Rohit Wellington for NDTV.
Well, moving to the other big headline, Tamil Nadu's new Chief Minister M.K. Stalin was sworn in today amid the state's worst COVID crisis. So his first decisions were on COVID. The state will now pay for COVID treatment in private hospitals. Also, they'll give COVID relief. Meanwhile, beds and oxygen continue to be a major problem for patients.
Muthuvel Karunanidhi Stalin ennum naan
on the day when DMK Chief M.K. Stalin took oath as Chief Minister, the scene outside the government Rajiv Gandhi Hospital reflecting the biggest challenge for the new Chief Minister. Outside the COVID block of the government Rajiv Gandhi Medical College Hospital in Chennai, at any point in time around 8 to 10 ambulances wait with critical patients requiring hospitalization, and it takes anywhere between 1 and 3 hours today to get a bed. Mahendran had to wait 2 hours in the ambulance before he could get a bed. His father, Mahalingam, says he had to be shifted from a smaller hospital where he was for the last 3 days as he needed oxygen support.
மூச்சு ஒரே வாங்குது 3 நாளா ஒரே குளுக்கோஸ் இதெல்லாம் ஏற்றிருந்தோம், ஜுரம் சளி இருமல் இருந்தது, 3 நாளா பார்த்துட்டு தான் இருந்தோம். அவரால் முடியலன்னு சொல்லிட்டு இங்கே எழுதி கொடுக்குறாங்க.
At Chennai's Government Stanley Medical College Hospital, 150 oxygen beds have been added in the outpatient ward. These zero delay oxygen points reduce the wait time in ambulances before their allotted beds.
Some time delay is happening. We try to provide them an oxygen cylinder to maintain their status, clinical status. If they are severe, there is no waiting time at all. They will be immediately wheeled inside.
Doctors attend to patients in ambulances and move them after evaluating their condition.
Initially, here patients may wait 4 to 6 hours like that. Now we are reduced the waiting time to around 1 to 1.5 hours to 2 hours. Within 2 hours, we are taking all the patients inside.
Soon after taking charge, the new Chief Minister announced that COVID treatment cost for the poor would be covered under the state's health insurance scheme, both at government and private hospitals. Chennai is reporting nearly 7,000 COVID cases every day, and the state has a positivity rate of over 16%. In Chennai with Shah Vijay, Sam Daniel, for NDTV.
But even as the situation worsens in Tamil Nadu, look at the difference in the hospitals and the infrastructure and the zero delay waiting that hospitals are already setting up in the state. That's really what happens when a state invests in health infrastructure. Meanwhile, in Karnataka, the Chief Minister announced a tough lockdown extension till the 24th of May. This as cases rise, nearly touching 50,000. But today, Maya Sharma reports from inside the Bangalore City Corporation's war room. Now, remember, this war room is where BJP MP Tejasvi Surya had that controversial outburst against Muslim employees just a few days ago. What's happening there right now? Maya Sharma reports.
Over 200 people work here around the clock in the BBMP South Zone COVID-19 war room in Bengaluru city, entering data, allotting beds, following up on cases. But 17 Muslim contract employees are not here after their names were read out by Bengaluru South MP Tejasvi Surya, who came here to blow the whistle on an alleged bed for bribes scam.
Zamir Pasha, Zabi Ullah Khan, Syed Hasnain, Syed Shahid, Shahid Shabazz, MD Yunus, Syed Moin Shah, Syed Muyesh Shah, Al Saeed. Who is this? Who are these people?
That alleged scam is being investigated and arrests have been made, including of Dr. Rehan, a man who worked here on contract with the BBMP. But those whose names were listed and shared on social media had to go to the police station twice over for no apparent reason. Surya's controversial comments disrupted work here, even as Bengaluru reeled with over 3 lakh active cases.
We have asked the agency to put them on a hold for a while. So once everything has been cleared from the police, the agency has assured that it will take them on their roles.
Was there a disruption in work because of what happened? Did people stay away? Was there a sense of disquiet? Was the work disrupted after that?
Yes, definitely a little bit. But now we are almost back. In 1 or 2 days, people have started coming back.
This officer herself was in that widely shared video.
We are in a war, Maya. We are fighting against an enemy who is invisible. So the strength is, I think we need to work together to overcome this crisis. Hold hands, if not physically, at least mentally. And I don't think we have the luxury of thinking about personal pains or whatever you feel for yourself when there's so much to be done. I have not done anything wrong.
Surya visited the war room again on Thursday night. But his office indicated in a tweet that reports that he apologized to people there were fake news. Work is back on in full swing at this war zone run by the BBMP in South Bengaluru, a city which has been attacked fiercely by the second wave of COVID-19 with more than 3 lakh active cases. Work in this vital area was disrupted for 2 days after the visit of MP Tejasvi Surya. He made very serious allegations about the allotment of hospital beds, charges that are being investigated and arrests have taken place. But events took an unfortunate communal turn when he decided to name 17 Muslim employees here. People who were then sent to the police station and have not yet been allowed to return to work, although most of them would like to do so. Most of them have no charges against them at all. With Govind Murthy, Maya Sharma in Bengaluru for NDTV.
And as that young officer said, that hold hands mentally, not physically. You don't need these distractions, these horrible communal distractions at this time. Maybe they can take a lesson from Kerala, where Sneha Koshi actually reports from inside Kerala's oxygen war rooms. Meanwhile, as cases rise here as well, the Chief Minister has announced that free food kits will be distributed for all families and guest workers, as migrant workers are called in the state.
At this district COVID war room in Kochi, now shifted to the integrated command center, larger than life screens project the latest numbers in terms of capacity occupancy, oxygen beds, oxygen availability. And for our update, data audit directly with each hospital in the district. Their primary focus also now, anything linked to oxygen in the district.
Initially, 2 weeks back when the surge happened, initially there were some distress calls, but now we have...
Distress calls from?
from hospital saying that there might be oxygen running out. But we have been able to mobilize oxygen till now, and for that we have formally created a war room for the past 1.5 weeks, and it has been functioning well. We have given another hotline for all the hospitals in case they are in terms of running out, inform us 6 hours before.
And as the numbers clock closer to the threshold level, efforts are ramped up to increase capacity, involving private hospital occupancy, a reason officials claim why a direct call to the hospitals may not get the patient's bed easily anymore.
At the same time, we are also increasing our capacity. For example, today we started a new specialty block in Government Hospital Ernakulam, which can cater up to almost 150 oxygen beds and about 18 ICUs. Similarly, we are planning to set up almost 1,000 beds in another facility.
A model followed across districts where patients are referred to them for shifting to hospitals from various sources. Here, including this telemedicine center at Ernakulam General Hospital, where doctors round the clock are categorizing COVID-positive patients from the district into A, B, C category. That would decide the medical response they receive from the district war room's shifting team. But it is not easy.
Enjoy coming here also, but at times when all the cases start pending up a lot, then even we feel stressed out and we are feeling helpless at times because we are not able to shift accordingly. People are panicking and that gets to us also at times.
Why are you not able to shift accordingly?
Sometimes there is a lack of beds. Sometimes from private hospitals we are not being able to shift to the government hospitals because there aren't enough beds there. So then we started the whole CAS, which is the government insurance in the private hospitals.
So it's better now?
It's better now.
In first we had only 200-300 calls in the initial time. And now the second wave, now we are dealing with 900,000-1,200 calls per day. The patients who are calling most of the patients are symptomatic, breathlessness. And now the main change is the young people, 35, 36, 41, 42 people are affecting this disease.
War rooms like these across districts in Kerala are supposed to be the point of surveillance and troubleshooting. They are supposed to be able to take the load of the state as COVID-19 cases surge to its peak. But it's going to be the test of time that they will have to pass to see whether the system has been able to hold itself. With camera person SP Babu, Sneha Koshi for NDTV.
It's wonderful to see the lack of panic, the organization, the planning that is happening in states like Kerala. But let's move to Maharashtra, where the worry is that after dipping below 50,000 3 days ago, cases in Maharashtra have again surged past the 60,000 mark today. Again, deaths are going up as well, but the 7-day average is still about 57,000. It shows a downward trend, but the challenges for this trend to continue the next few days are going to be crucial. Meanwhile, Maharashtra is preparing for what they said is the third wave, with the health minister saying that this could be very dangerous for children below the age of 18 because they wouldn't be vaccinated. So he said the state is planning for this and a pediatric task force is now being made.
माननीय मुख्यमंत्री जी ने कल रात को 10-11 बजे बहुत लेट आवर्स तक मुंबई के और अन्य पीडियाट्रिशियन से बैठक ली है। हम एक पीडियाट्रिशियन टास्क फोर्स बना रहे हैं क्योंकि 18 साल के आगे के लोगों के लिए हम टीकाकरण कर रहे हैं, लेकिन 18 साल के नीचे के उम्र के लोगों बच्चों में टीकाकरण नहीं हो रहा है। और दूसरी बात ये भी है कि पीडियाट्रिक टास्क फोर्स हम बना रहे हैं, उनका जो मार्गदर्शन रहेगा, उनकी जो भी गाइडलाइन रहेंगे, उनके मुताबिक हम उसके मेडिसिन जो लगेंगे, क्योंकि बच्चों के लिए अलग तरीके से मेडिसिन लग सकते हैं, उनके वेंटिलेटर्स अलग तरीके से होते हैं।
Well, great that Maharashtra is learning and preparing, but let's go across to our special report, because the focus really, when we look at the health crisis, is the impact on human lives. Amongst those most stretched are those who are working in Delhi's cremation grounds, where deaths are at a record high. We profile a young worker at a cremation ground. He's only 19 years old. There's no break for him. In fact, he doesn't even have a PPE suit, or neither has he been vaccinated. He tells NDTV that he works from 5 a.m. till after midnight with no break.
A 19-year-old crematorium worker is building his 7th pyre of the day at Ghazipur Crematorium in West Delhi. He works in the dedicated COVID section of the crematorium without any PPE. The flames are too hot and too close to wear a plastic suit. He didn't want us to reveal his name because of the social stigma attached to this work, which is usually performed by people of the scheduled castes. Far from home in Ayodhya, UP, he works more than 12 hours a day and sleeps on the premises.
ऐसा रोज होता है और जो हमें आराम करने का टाइम नहीं मिलता रात के 12 साढ़े 12 बजे तक। उसके बाद साढ़े 12 बजे के बाद हम सोते हैं खाना वाना खा के, फिर 5 बजे सुबह उठना पड़ता है, साफ़ सफाई करना। उसके बाद जो अस्थियाँ लेने आते हैं सुबह, उन्हें अस्थियाँ देनी पड़ती है। उसके बाद फिर 10 बजे क्रीमेशन स्टार्ट करते हैं। नीचे डर भी है और काम भी करना है हमें तो, और जो है क्रीमेशन बनवाना पड़ता है।
आप क्यों रह गए?
जी हमें देखो थोड़ा डर तो था, लेकिन हमें काम भी वो करना था। हम काफ़ी दिन से यहाँ हैं, तो जैसे हमें अचानक नहीं जा सकते छोड़कर, जिम्मेदारियाँ थी ऊपर कि हमें जैसे काम करना है यहाँ का। हम छोड़ के चले जाएंगे तो यहाँ थोड़ी जो आने वाली पब्लिक है यहाँ आएगी, बॉडी आएंगी तो उन्हें परेशानी होगी आप उन्हें करने से काम।
He has left the cremation ground only twice in the last 2 months, as he needs to be available almost 24 hours a day as the COVID-19 death toll in Delhi reaches record highs. Bodies also arrive here from the neighbouring UP. He says he can't think too deeply about these deaths.
मैं अपने आप को देखिए हमारा सादा भोजन है करते हैं और थोड़ा वर्कआउट
तरीके से पूछ रहे हैं।
नहीं, मानसिक ज़्यादा हम दिमाग पे जोर नहीं लेते हैं, ठीक है जी। जो काम हमें करना है वो हम आराम से करते हैं।
The priest here, Ram Karan Mishra, told us that the workers did not have the time to get vaccinated.
टीका नहीं लगा, वैक्सीन कोई यहाँ पे कोई उपलब्ध नहीं कराया वैक्सीन, तो यहाँ अभी हम लोगों को किसी को टीका नहीं लगा।
लगवाना चाहते हैं
अगर यहाँ पे अगर आगे स्वयं यहाँ पे अगर, क्योंकि यहाँ बहुत डेड बॉडी आती है, बहुत समस्या, हम लोगों के पास टाइम नहीं है। सरकार को तो पता है सारी बात, कहाँ वैक्सीन पहुँचानी कहाँ नहीं पहुँचानी है, बाकी अब क्या बताएं सरकार को।
Workers here are paid between 10 to 15,000 rupees a month, and none felt comfortable sharing the last time they were paid. They feel they are performing their religious duty. We have seen body after body arrive here at the Ghazipur crematorium. The workers here work almost 24 hours a day, and then they lay their beds right here in the open air and get 2-3 hours of sleep a night. They are overworked, underpaid, unvaccinated and uninsured, and it's time the government showed some support. With Pooja Arya, Meher Pandey for NDTV.
The reality of what India's poor are going through, even those who are performing such an essential service at this time. Meanwhile, in Hyderabad, these shocking visuals coming out of huge crowds today at Friday prayers, the last Friday prayers before Eid. So you can see there these Friday prayers, no social distancing, no masking at all. After these visuals went viral on social media, today the Telangana government has announced orders saying that in view of rising cases, no more than 100 people at marriage celebrations, no more than 20 at funerals, and all public gatherings, social, political or religious, are banned. But this comes, as we said, after these prayers and the worry of course, spread of cases, even though Telangana is reporting just 1.1% positivity rate currently. Well, a political backlash hours after Prime Minister Narendra Modi spoke to a series of chief ministers on the COVID situation in their state, when Jharkhand Chief Minister Hemant Soren tweeted that the Prime Minister didn't listen to him during the conversation, but only did his Mann Ki Baat. So, of course, BJP senior leaders and BJP chief ministers have attacked Hemant Soren for his comment, but so has Jagan Mohan, the chief minister of Andhra Pradesh, who tweeted saying that you are like my brother, but you shouldn't have said this about the Prime Minister. Such level of politics would only weaken our own nation. In this war, this is not the time to point fingers, but to come together and strengthen the hands of our Prime Minister. Mr. Soren, of course, says that his situation of his state in Jharkhand wasn't discussed at all. Well, another look at some quick news. 96 oxygen concentrators found in a restaurant in Khan Market called Khan Chacha, owned by businessman Navneet Kalra, who owns many other restaurants in this popular market in South Delhi, including Town Hall. The 96 oxygen concentrators found here seized by police, who say that these were being imported from China at about 15 to 22,000 and being sold for 50 to 70,000. That's the profit that is being made with these oxygen concentrators at a time when people are in such desperate need. But even at this time of distress, we must focus on what's happening in the humanitarian aspect, and so many people from all over the world are coming to help India. And the biggest consignment yet from the United Kingdom has now left Heathrow Airport with more than 100 advanced ventilators. All this collection being done by the Indian diaspora, including Indian doctors and other NRIs. Airlines are transporting this without charging any fee.
Ventilators to go to India.
How many of them?
There's a good over 100 there easy.
2 truckloads of ventilators being air freighted from the UK to India by Indian origin doctors in Britain. British charity Hope to Sleep has arranged the equipment, which are advanced and non-invasive, meaning a patient on a ventilator does not need to be incubated to receive oxygen. Also on the truck are some 1,000 oxygen cylinders, some 20,000 oximeters, air filters and other medical equipment.
We're emotional actually, to be able to think that we had the equipment that we've seen other charities trying to raise money for, which is now going across to help the people in India.
Airlines such as Qatar, British Airways, Virgin are among others which are transporting this emergency equipment at no cost. Once it lands in Mumbai in India day after, industrialists who have businesses in India and the UK will take it from there.
Collectively, the Indian diaspora in the UK is raising close to £2 million, all of it online. British doctors, Indian doctors, as part of their organisation called BAPIO, who form the spine of the NHS here in the UK, are not just sending equipment, but they are also remotely consulting and also reading reports. Radiologists are reading scan reports simply because Indian doctors are just very exhausted.
We are waking up at 4 o'clock in the morning and doing teleconsultation, tele-ward round to support our colleagues back home who are working relentlessly. They are getting exhausted. And we are following their guideline and working in partnership with them. The pain back home is hurting us.
According to the High Commission of India in London, Indians in the UK have donated close to £1 million in the last 3 weeks to the PM Cares Fund. Radhika Iyer in London, NDTV.